Erica's story was quite beautiful. It's also good to hear personal stories of people that have gone through this and have success stories. And it just shows that it takes faith as well to keep going. They say the art of knowing is knowing what to ignore when all odds are against you. To just know that I will still keep going because I know that I might just be the success story. And our next speaker is Claire Julsing Strydom. She's coming to speak about what diet is best for PCOS. Claire Julsing Strydom is a registered dietitian and co-founder of Nutrition Solutions, one of the largest dietetics practices in South Africa. She has been in clinical practice for 18 years and has a special interest in treating polycystic ovarian syndrome, obesity, and chronic diseases of lifestyle. She is a past president of the Association of Dietetics in South Africa. She completed her Master's of Science degree in Dietetics and has presented nutrition educational content to health professionals both locally and internationally. Claire, the stage is yours.
Good morning, everybody. It's so lovely to be here, and it's so nice to have you all in the audience here. And I really want this to be a session where you ask your questions, so don't be shy, make little notes of the questions you want to ask me. As a dietitian, I think everyone always has a question for the dietitian. Even on the aeroplane, people are like, "Are you a dietitian?" I'm like, "Yes," and then they start with the question. So I'm all here for you all to learn from today's session. So just as a start off, I'm a registered dietitian and I have PCOS. I've had it for a long time. I've battled with the infertility. I've had the acne. I've had the weight gain. I've had the hair balding, the hair growth, the plucking the beard. I mean, I have a pact with my best friend to say, if I ever die, she must just pluck the beard hairs before they bury me. I also have PCOS. So I know the struggles. I know how they are. But what I also know is when you do have PCOS, you're super vulnerable to the diet culture out there and what you get told and what you see and what you hear. And so many women that I treat say to me, I don't know what to do. I don't know where to start. So in today's short presentation, I'm going to try and give you as much information as possible about the key things that I'd like you to focus on to start helping your PCOS. So if we look at PCOS, we know that it's an inflammatory metabolic disorder. And we also know that nutrition plays a major role in how this disorder gets put together and what actually happens. I say to patients, having PCOS is like building a 1,000-piece puzzle, okay? Because there's so many little bits and pieces that we have to get right to get the outcomes that we're looking for. Okay, so they published the International Evidence-Based Guideline for the Assessment and Management of Polycystic Ovarian Syndrome in 2018. And as a dietitian, I was a little bit disappointed because there are only 2 pages on nutrition in that document. It's quite limited. But I just want to point out some of the key factors that they mentioned in this paper, which was quite a big sort of movement in the PCOS space, is that we need to have balanced diets for PCOS. We also need to make sure that we tailor the guideline that we give to the patient based on their food preferences, allowing flexibility and individual approaches to reduce total energy and also help with weight loss. We know with PCOS, if you can have a 5 to 15% weight loss, you can improve fertility. Okay, so if you weigh 100 kilos and you lose 5 kilos, you've already started to make a difference. Okay, because I know what happens. You sit in the office of whoever it is and they take out the calculator and they chun, the BMI numbers come out there and they tell you're morbidly obese, and it's quite overwhelming for a lot of us. So already start off with the notion knowing that just that small change in weight already starts having a positive impact. Okay, so you're going to say, but Claire, what diet? Which one? Which one's the best one? Okay, so this was a paper published by Katz and Miller, and what they did is they looked at all these different types of diet. They looked at low carb, they looked at vegan diets, they looked at vegetarian diets, they looked at the normal Mediterranean dietary, in the dietary guidelines, they looked at paleo or carnivore diets, and they looked at all the pros and the cons of these different diets. Now, the interesting thing was there were key factors across all these diets that were similar. okay? Because we can get so overwhelmed by what must I eat, what must I do, this influencer says that, that one says that. You scrolling on Instagram and you actually are completely overwhelmed, okay? If you felt like that, you can give me a little nod there, right? Because I'm seeing ladies are shaking their heads and smiling. So what were the key findings here? Okay, they said we need to limit refined starches and added sugar. So that means your refined starches are the white breads, the white crackers, the bagels, the white like maize meals, the white rices. Anything with a fiber intake lower than 6 grams per 100 grams is considered to be low in fiber. Okay? We need to limit added sugars. If you're having 3 spoons of sugar in your tea and you're having 4 cups of sugar, 4 cups of tea and you've got 3 spoons of sugar, people are rolling their eyes and looking at the ceiling over here because you've got 12 spoons of sugar and that will impact, it will have an impact on your health, and we've got to start looking at those things. We want to limit processed foods, and by processed foods I don't mean pasteurized milk. That's an important process, okay? I'm talking about things like highly ultra-processed foods, like something like a polony, those kind of things, are not highly rich in nutrients for us. We want to also limit the intake of certain fats. So when we talk about fats, we get monounsaturated fats and polyunsaturated fats and saturated fats, okay? So your monos are things like olive oil and avos and nuts. These are excellent for PCOS because they're a long-chain fatty acid. They help with cell membrane permeability. They're really good for us. Your coconut oils, your butters, your creams, ghee, they are saturated fats. They're not beneficial for PCOS. They actually have an inflammatory impact, which we'll have a look at in a second. Then it's lots of whole plants. Okay, who ate 4 cups of veggies yesterday? Can you all recall what you had yesterday? 4 cups? I'm not seeing any hands are going up in the audience, okay? Because we need, somebody said, Claire, if you could make a billboard with one nutrition message, what would it say? And I said it would say, get the good stuff in. We're so focused on, oh my gosh, I can't eat this, can't eat that, da-da-da-da. But out of everyone here, no one's like, yes, me, I did 4 cups of veg yesterday. Okay, and remember this 4 cups of veg rule? I'm going to show you something just now again. Then obviously with proteins, we want to have lean proteins, also use legume-based proteins, plant-based proteins. So the key finding here was eat food, not too much, mostly plants. What do they basically mean? They mean make every single meal, make veggies the hero. Your plate should be half your plate veg at lunch and dinner. And why not throw some veg in at the breakfast as well, okay? So that's how you've got to start, guys, because if you can get your veg, most of the plate, and portion control everything else, that's going to make a big difference for you. Okay. So I want to focus on 3 key things, because I said I want to talk to you about getting the good stuff in. We're going to look at inflammation, fiber, and phytonutrients. Okay, and if you can get these 3 things better in your diet, and you're starting changes, you have to promise that you can at least message me on Instagram and let me know that you've made some shifts from after today and you've reduced sugar in the tea or whatever it was, and you let me know, okay? So the first one's inflammation. Unhealthy nutrition patterns are emerging for their association with the activation of the innate immune system, and it triggers low-grade chronic inflammation. Now, what does that mean? That's quite a mouthful, okay? When we eat an entire pizza all at once, our body's not meant to eat that at once. It can't handle that glucose load. Okay, so it's the same as eating like 16 slices of bread if you eat a whole pizza. Okay, so it's highly energy dense, and it actually damages the little cells, and we get an oxidative reaction or oxidative stress, and that's the cell damage. Now, it's the same as me taking a knife and slicing my hand open and it's bleeding and it's damaged. I have to have an inflammation response to trigger an immune response. So, when you eat poorly, you are constantly triggering an inflammatory response and an immune response. Okay, you also get sick more quickly and more easily because half your little immune cells are off fighting the pizza load that you're doing day, night, what. Okay, I'm not saying you can't have pizza, just hashtag I'm a nice dietitian. You can still have pizza, but maybe 2 slices and a massive salad. Okay, we've got to, the thing I want no one to walk away from with this is going, oh, the dietitian said the pizza's bad, I can never eat it again. No, this is your life, guys. PCOS doesn't disappear. You can't reverse it. It can't just melt away. You can manage it extremely well, but the changes you make are the ones that's got to stick with you. This is a chronic disease that we have to manage. So you can't go on these extreme diets because you're not going to stick to them. So this diagram actually shows you, and I'm going to just turn here. So if our gut function's not good and we've got dysbiosis in the gut, or our diet's not good, or there's isolation, guys. What have we been doing for the last 2 years? Isolating, okay? And chronic stress, we're not sleeping 7 to 9 hours a night. We're physically inactive, so not just not being active, but we're sitting more than 6 hours a day watching Netflix, binge watching. We are inactive, okay? These factors are switching on systemic chronic inflammation, and that is making all of these chronic diseases, the risk for these chronic diseases get worse when our inflammation is high. Okay, so it's the same, when you eat that whole pizza, it's the same as you smoking. Same damage. Okay, that one hits home because you're like, I'm very good, I don't smoke. I'm like, well, that kind of poor nutrition is also going to have an inflammatory response. So we actually can measure your inflammation. We look at ferritin, we look at CRP, or your C-reactive protein, to see, is your inflammation high? You know, we can check these things. So how do we combat this high inflammation? Well, you get foods that are pro-inflammatory and anti-inflammatory. Saturated fats are pro-inflammatory. If you're putting coconut oil in your coffee every day, you're increasing inflammation. Okay? If your diet's high in energy, if you're eating foods that are excessively high in energy and it's too much, that's an inflammatory response. But something like olive oil has an anti-inflammatory response. Pilchards, sardines, the omega-3s, anti-inflammatory response. Lots of veggies, anti-inflammatory response. So your diet's literally shifting the dial on the inflammation. Okay? Fiber is another way that you can down-regulate inflammation. And if you're not eating 25 grams of fiber every single day for your PCOS, it is one of the biggest areas that you're missing out on. And let me explain why. Someone asked me just before, the shaman mom asked you a question before we get there, but if we cut out carbs, we cut out fiber, okay? So people go, but Claire, we will get the fiber from the veggies. I just asked you guys just now how many of you ate 4 cups of veg a day, and no one put up their hand. If we look at 3 cups of lettuce, you get 1 gram of fiber. A cup of Brussels sprouts, 3 grams of fiber. Any idea of how much fiber you need in a day? It's 25 grams a day. So you would need about 15 cups of veg a day if you're going to reach your fiber intake from veg. So what I'm telling you all is that will never, ever happen. I've been a dietitian for 18 years, and by the way, you can eat butternut and carrots and beetroot. I've never, in 18 years, had a patient that I say, listen, you've been overeating on the veg. Can we please pull back? Never happened in 18 years. Okay, so we need to stop with these, I don't know, they're like the nonsense nutrition talk out there. It needs to end, because it just makes us all feel bad about ourselves, actually. Because we're like, I had a patient that said to me, Claire, I can't have a baby because I eat bread. I'm like, what? I'm like, that is rubbish. You can absolutely have bread and have a baby. Let's just get you on one that's high in fiber. But this is the kind of things women sit down and talk to me when they come and see me. And it's every single lady that sits there, I've got my box of tissues ready, they cry, they tell me all the stories, and this is the stuff they're telling me, and it's crazy. So we know the WHO actually looked at systematic reviews and meta-analysis, and they showed that when we can increase our fiber, we decrease diabetes, coronary heart disease, mortality, cancer risks. Those are all linked with PCOS. So the sooner you get the fiber right, the better it is for your long-term health. Okay. Our phytonutrient intake. What are phytonutrients? Yu's granny told them if you eat your carrots, you'll see well at night. Okay, your granny is actually really clever, because that's a true story. If you have carrots, you're getting beta-carotene. Those beta-carotenes help with your eyes. If you have resveratrol, it's the purple color in a blueberry. That reduces cholesterol. Something like dial sulfide, so your leeks, your garlic, your onions. These are really, really good for immune function. Okay, I've put 4 on the screen. There are over 2,000 different phytonutrients. Where do you get them? you start eating colorful veggies, lots of colors, lots of variety, because you know what we all do? We all go to the shop and we're like, spinach, butternut, apples, same, every week, isn't it? We don't swap. So my advice to everybody is when you go home today, make a list of all the fruit and veg in your house, put that in your wallet, and the next time you go to the shop, try not buy the same things on the list from last time. Okay? Go a little bit out of your comfort zone. Maybe try a radish, fennel. You know, look, everyone's like, what's that, Claire? I promise you, everyone, we need to broaden our horizon with veggies. I promise you can go Google how to cook fennel, and you'll get like 1,000 recipes. That's the joy of the internet, right? Okay, so try to have more variety, more color in your diet with the 4 cups of veg every single day. This was a really nice summary of key things we should be doing, and it was published by the HPCSA Society in the US. So the first thing is you've got to have calorie restriction if we've got to get the weight down, and for most women with PCOS, this is something that we struggle with. We battle with very high insulin levels, high inflammatory responses. We've got to get the weight down. We actually also want to make sure that the type of fat we use is that monounsaturated fat. We have to push fiber. I sound like a crazy person, but just switching, if you start looking at labels. If you turn packages around, on the back of the package, it's going to tell you the fiber per 100 grams. So you can get a brown rice with 4 grams of fiber, which is not even high in fiber. 6 is the cutoff. And you can rather choose something like bulgur wheat has got 18 grams of fiber per 100 grams. So when you have that fiber in your diet, it helps to produce short-chain fatty acids. There's one called acetate that actually down-regulates inflammation. We know there's propionate, butyrate, and acetate. All of these short-chain fatty acids help with insulin, with blood glucose control, with inflammation, and it's all in the gut. Your gut is the new brain. If we don't look after the gut, it causes problems for us. Okay, so we need to also make sure that we're getting in, we want that weight loss of between 7 and 10%. And we've got to do bloods, ladies and gentlemen. You've got to check your levels. If you do not have bloods done, if you haven't checked things like your magnesium, your B12, your iron profile, not just ferritin, because ferritin in PCOS women is always high because they're always in inflammation. So it looks all perfect, but they're completely anemic. So you need to check your full iron profile, your full blood count, vitamin D, very important for PCOS. Okay, those are just the nutrient side of things. There's also the hormones, the things like your HbA1cs and glucose, etc. You do need to check bloods as a starting point. Otherwise, you're sort of shooting in the dark and you don't know where you're at. Okay, so these are just my top steps for success. Make sure you have a thorough assessment. Go get a body composition, because a BMI for PCOS is just the worst thing in the universe, because most of us have a much higher muscle mass than other people. We've got our machine here. If you want to do a body comp, come do one afterwards. It's 100 Rand, which is normally 300 Rand, so it's super, super good. But you need a body comp so you can actually see what is my fat mass, what's my internal fat around my organs, what's my muscle mass, what's my fluid like, am I completely dehydrated? It gives you a lot more information than just a scale. If you see a dietitian, you haven't seen the dietitian if you haven't been for 14 sessions in 6 months. Okay, so if you're like, I one time saw this dietitian at my assessment for my points, you did not see the dietitian, guys, sorry, you didn't. Okay, you need to work with the dietitian and make adjustments to your diet lifestyle. We've said get the bloods done, get the eating right in a stepwise approach. You've got to look at nutritional supplementation based on blood requirements, move more. Try not have late night snacking, 3 to 4 cups of veg a day, cut back on those refined starches, cut back on the sugars, focus on fiber, good quality fats, portion controlled. You can't just be like throwing olive oil over everything. It's a teaspoon is a portion. So about 3-4 teaspoons a day is probably enough. And also then we need education in this space. So if you need help with education, I do put out free information on our nutrition platforms for nutritional solutions, as well as Dietitian Claire is my own one with a lot of PCOS advice. And I said there, it's one day or day one, it's your decision. So I thank you for your time, and I really would love you to ask me lots of questions. So thank you very much.
Any questions?
Hi, sorry, I have two questions. The first one is for the PCOS. Prebiotics versus probiotics for your gut health, which one is better?
So you would take a probiotic because the prebiotic should actually be coming from your food. So things like apple and wheat and your onions, your basic healthy diet will be the food for the probiotic. So there's a lot of different literature on this, but probiotics are really important for PCOS. You want lactobacillus and bifidobacteria in a probiotic in PCOS. And also please look at your CFUs, that's the colony forming units on the bottle. You want ones with higher amounts. Okay.
With regard to my question earlier, the carnivore diet for the PCOS,
Okay.
what is
So thank you for your question. I did ask you to come ask me again so that you can all... So the question over there is the carnivore diet good for PCOS? Because people are like, well, I cut out carbs and then I lost all this weight. But the question is that diet actually serving your PCOS? We know that if we have too much protein and it's too much animal protein, it can actually also impact testosterone levels in women with PCOS. We actually saw a 41% ovulatory infertility caused by high animal proteins in the diet. The exception was for fish, egg, also dairy was okay, and legumes. So using more plant-based foods in the diet as well was really helpful. So you do need protein though, okay, but the thing is, if you're doing carnivore, you're not doing carbs, and you're going to get a higher saturated fat intake in the diet because you're eating more animal proteins. That saturated fat is affecting your inflammatory markers. So the thing is, you can do a diet like that, but what's it doing to your hormones? What's it doing to your CRP levels? You know, we don't see that side of things. People go, well, I'm losing weight. The weight loss will help with the PCOS, but I've had patients that have come to me, sent by the gynae, because the patients have done like paleo, they've cut out carbs, they've lost all this weight, but their hormones are in tatters, and they're not falling pregnant per se either. Okay, so you saw the fiber thing. We need the fiber. If we're not getting fiber, we're not going to get that gut functioning properly. Okay, and you're actually going to get dysbiosis in the gut, and that's one of the triggers for chronic inflammation. So have protein, have lean protein, do more fish, more legumes. One of the best proteins you can do is sardines, pilchards, salmon, mackerel, trout, omega-3 fatty acid rich fish. Add carbs that are high in fiber. Do barley, do bulgur wheat. Do those carbs. I'm not talking like, oh, now let's add like wraps, and because the dietitian said add carbs. High fiber carbs. And I'd say to my PCOS ladies out there, make that cut off 10 grams of fiber per 100 grams. Push it high. We're talking functional, good quality carbs, not mediocre. Okay, and then the good fats, like the nuts, the avos, the olives. If you're going to eat a piece of steak, cut the fats off, because that's not serving you from an inflammatory perspective. Okay, so does it answer your question? Thank you. Okay.
I just have a question regarding inositols. Often we hear about that they're important in PCOS, the ratios of them, what kind of inositols, how do we get them?
Thanks so much for that question. So the question is, inositols, how much must we use? What should the dosages be? The thing with inositols is they are actually now seen as a first-line therapy for PCOS, okay? You get myo-inositol and D-chiro-inositol. Now, they have health benefits in terms of helping with insulin, they help with egg quality. They actually act as a secondary messenger to help with glucose metabolism as well. But the thing with inositols is you need the right dosage of inositol and you need the right ratio of inositol, especially if you're on a fertility journey with PCOS. So myo-inositol can convert to D-chiro-inositol, but the ratio is a 40-to-1 ratio. If you only take the D-chiro-inositol or you take myo-inositol without the D-chiro, we get what we call the paradox effect, and that can actually make fertility worse. So you want a 40-to-1 ratio, and then what you also want is the inositols are very much the same chemical and structural. They look very similar to glucose. So if you take inositols, take them away from a meal, take it either first thing in the morning or absolutely last thing at night when you're taking inositols. It also depends on the combination that you're using. You want to do a 4,000 milligram dosage of inositol to get complete therapeutic benefits. And because of that same structural component as glucose, they have shown in systematic reviews that the higher dosages are going to be more effective. Because if you're taking a smaller dosage, there's a lot more competition with the glucose in the gastrointestinal tract. So 4,000 milligrams myo-inositol, 100 milligrams D-chiro-inositol. There are quite a lot of different products in South Africa that meet that ratio, so just go have a look. Okay, thank you for your question.
Hello? Hello? Yeah. Okay. Okay, so I've got two questions.
Okay.
The one was related to the diet. I don't know about Banting diet, because
Okay.
Banting is slightly different from the carnivore diet in that you
It's higher fat.
actually, you eat the veggies and you eat all these high fiber veggies. Would the impact be the same?
Yeah. Okay, so if we look at ketogenic diets and Banting, it's a keto diet. It's a higher in fat diet. So we know, first of all, that you won't reach the veg, you will not reach the fiber intake in a Banting or keto diet. You won't from veg. You'd have to take additional supplements separately from your actual food, number one. Secondly, it's not a recommended diet, even for weight loss. Not even for PCOS, but they published the Canadian Obesity Guidelines in 2020 in August, and they actually found that the ketogenic long-term had more negative effects on our cardiovascular health. It's increasing triglycerides. It's the health impact is not good. Okay, so, and your fiber is also not going to be there. So the thing is, if you're going, but I want to do it for weight loss, it's not going to help your PCOS. So is it a diet for PCOS? Is it a diet for weight loss? You don't have to do that diet for weight loss. The other Mediterranean is more competitive than a ketogenic diet if we look at big systematic reviews and clinical data that were published in these global guidelines just a year and a half. So it's not, you'll lose weight because you have a calorie deficit, you'll feel more full from the fats, but you can still do 40% fat in your diet, do nuts and avos and olives so that you're getting the fats in the meal that helps with slower gastric emptying. Have protein, but add in carbs with high fiber. Have high take in a veg. There's no need for you to cut out entire food groups. Okay, does that answer your question?
Okay, my second question was actually linked to hers.
The inositols.
The myo-inositol. Okay, so I was on something called Inofolic.
Yeah.
I used it for like 2 months, and it made my cycle regular.
Yes.
And then it kind of stopped
Okay.
being regular. So I was like, does it wear away?
No, it doesn't
Am I
wear
doing
away.
it wrong?
No, you're not. But remember, so my inositol is different from my inositol with D-chiro-inositol. In PCOS, infertility, it's also actually good to use the D-chiro-inositol with the myo-inositol. So the same people that make the inositols have a different one for PCOS. What was the other part of the question? Oh, is that it? So you can use, it doesn't wear away, sorry, it doesn't wear away. It takes about 6 months to actually get the dosage where you want it from an inositol perspective. So in clinical data, at about 24 weeks, you're going to see something. So you could start with inositols, the cycle comes back. So what I see in patients is that have a 38-day cycle. Then all of a sudden it's a 70-day cycle. Then we're back to a 45-day cycle. Then but then after like 6-7 months of being on it, that cycle starts to become more regular. Okay, so just be patient. Remember, it's not just the inositols. It's also looking at your vitamin D, your dietary intake, your stress, your exercise, your sleep. PCOS is like a 1,000-piece puzzle that you're putting together. So when something shifts, you've got to look at all those different angles. But the inositols do work. There's clinical data that does support it. So be consistent with it. And it's already brought your cycle back. Just be patient with getting that cycle now really regular. Okay. Sure.
Thanks for that, Claire. It was lovely. Please, can you just clarify the link between dairy and inflammation and the link with that to polycystic ovaries?
Okay. So if you on Instagram, you'll see that because you have PCOS, you can't have dairy, you can't have gluten, and that gets pushed a lot in the PCOS space. Okay, so let's talk about gluten first. If we look at the science around PCOS and gluten-free diets, you do not have to cut gluten out of a PCOS diet. We cut out gluten when there's Hashimoto's or there's celiac disease. Then we would need to remove gluten from the diet. For straight PCOS, you do not need to remove gluten. In fact, what happens when gluten gets removed, in most cases, fiber disappears. Because now everyone's buying these gluten-free muffins at the shop, which is like a little cake of refined carbs, which is making inflammation worse and dropping fiber. So you do not have to cut out gluten for PCOS. Okay? Secondly, dairy. Because they also say no dairy. Okay? We know if you have high androgens and you battle with acne, we would probably pull back on dairy, and it would be more back on the skim kind of milks in that situation. To blanketly say no dairy for everyone with PCOS is actually incorrect. The people that make those statements will often say, oh, dairy is high in inflammation, that's why you can't use it. If you look at the literature, so I did a full literature review this year on dairy, on inflammation, what the clinical picture looks like, and often what happens in the scientific evidence around dairy, ice cream, cream, butter, yogurt, cottage cheese, all get clumped together, and then there's the outcome. Obviously, if you're eating ice cream for breakfast, you're going to have an inflammatory response. But if you're having a cottage cheese, or you're having a fat, like a low fat, or it doesn't actually matter if it's full cream, low fat, skim, it doesn't actually matter. It's just the portion that changes. You are getting calcium, you're getting also probiotics for the gut function. So there's benefits to using dairy, but the right type of dairy, the right type of starch. So there's all the nitty-gritties in nutrition. Don't get sucked in by social media. Okay, and also start asking these influencers, where's your reference? And they mustn't send you to a YouTube clip. They must give you the PubMed ID for the medical journal that supports what they're saying. The public needs to start calling out these influencers on incorrect information. Okay. Thank you. I think that's... Are there any last questions? I think I've got a minute, if I'm correct. Any last questions? Okay. Thank you so much for your time. And like I said, if you've got questions, I'll be at our stand if you want to come chat to me. And you're also welcome to ask me questions on social media. It's Nutritional Solutions SA or Dietitian Claire on Instagram. Thank you so much, everyone.